Hello. Welcome to this week's community update. I am Chana Gasetis, the spokesperson for Boulder County Public Health, and we are very glad that you're here. Today, we will get an update from Jeff Zayak, our Executive Director for Boulder County Public Health, as well as we are joined by Rob Anderson, Superintendent for Boulder Valley School District, and Don Haddad, Superintendent from St. Vrain Valley School District. So we look forward to hearing from them. And now I will pass it over to Mike Stratton, who will cover the housekeeping. Thank you.
Good afternoon, everyone. I'm Mike Stratton with Boulder County Public Health. A few quick housekeeping items before we get started. We will take questions at the end of our webinar. You'll notice a Q&A at the bottom of your Zoom screen. Click on that, type your question in, and we'll read that out loud for you. If by chance you're on the phone, you can push *9. That will raise your hand and we'll call on you to ask your own question. And if you are watching this and you don't have a question, you want to watch it another way, you can watch our YouTube channel where this is being broadcast live. That's at boco.org/PHYouTube. And we will record it and put it on that same page. If you have questions and you are on YouTube, you don't get your questions answered, you can certainly send us a message at healthinfo@bouldercounty.org. And now let me turn things over to Jeff Zayak, Executive Director of Boulder County Public Health.
Thanks, Mike, and thanks everybody for tuning in again today. I really want to thank our two superintendents, really appreciate them taking the time to join us today on this important topic. We've been having a lot of conversations with the community around kids and schools getting kids back to school. And we've got our two superintendents here with us today to help emphasize some of their plans, as well as talk with us about answering questions relative to school. So I want to thank you both for joining us. Also a happy new year to everyone. We all certainly hope that 2021 carries better things for us as we move forward. I'm going to go ahead and share my screen and cover the data update here. And today's data update, I'm going to focus more on what we have been looking at in terms of data relative to schools. So as I go through this, I'm going to spend a little more time on schools and a little less time on more of the data that I might have showed you in the past weeks. Just to start with, this is our data from the state dial, and unfortunately, but somewhat expected, we are seeing our numbers increase. So again, for folks who are just tuning in for the first time this week, these three indicators right here, our 2-week cumulative incidence rate, our Boulder County average positivity, and declining or stable hospitalization indicators are what generate where we land on the dial. And right now you can see that we are on the dial in orange. Last week, when I presented, our cumulative incidence rate was below this red indicator and was actually in orange. So we are seeing some increasing numbers, and that is primarily associated with our Christmas holiday, as well as, and we expect more in New Year's. When we looked at mobility data with the state the other day, we could see that mobility data was also indicating more movement as compared to Thanksgiving. So we are expecting that our cases will continue to increase a bit for the next few weeks. This is the metro data, and you can see that Boulder County is the line in red. We still have the second lowest number of new cases in the state, but unfortunately you can see that there is a rise in cases across all the metro, with exception of Broomfield right now. And again, we do expect to see these continue to increase as we move into these next weeks. This is our average 5-day number of new cases. We are at 83. We were headed in the right direction. We are very much hoping that any new cases that increase associated with winter holidays and with New Year's is a low spike, because we are just getting back into the range of cases where we can do effective contact tracing and case investigation. And that, of course, is one key component for us to be able to help control the spread of this disease. This is our 2-week trend in incidence for all age groups across the county. And what I want to do is point to two things here. I'm going to point first to this bottom line, which is the green dotted line. I know this is a little difficult to see on here, but this is our 0 to 9 age group. And what we've consistently seen in this age group is that is one of the lowest numbers of incidents, is both in the 0 to 9, and that's going to actually confirm some of the data that I'm going to talk to you about that we've been looking at both at a national, a local, and a state level. And then the second one I want to point to here is the orange line right here that is now the second line above the bottom. This is our 10 to 17-year-olds. And what we've seen in the research is that there's very little spread from young kids to adults in the 0 to 9. And as we move up into the older age groups for schools, so if you start to think about 6 through 8 and then 9 through 12, the older the kids are, the more chance they have for spreading the virus to adults. And you can see here in the middle of our peak, our 10 to 17-year-old age group was right about in the middle of the age groups in terms of number of cases and 2-week incidents. And so again, that's consistent with what we're seeing in the data that I'm going to talk about. And it's consistent with why we've recommended what we have to both St. Vrain Valley School District as well as Boulder Valley School District, which we'll talk about in a minute. This is our average positivity rate. Ideally, we want this to be low, below 5%. We are a little bit above 5.4%. And this is our 5-day average versus the indication on the dial, which was 4-some odd percent, which is a 2-week average. The reason we track the 5-day average is because we can see more quickly when things change in our numbers. So that's why we are tracking both of those. And we are seeing that it's increasing. The message I'm going to say here that I'm going to also repeat at the end is we have ample free testing in our community. You can go to Boulder County Public Health COVID-19 testing. You can find all of our test sites, the locations, if they're free or not, and the hours of operation. Please do take advantage of it. We do have free testing that's easily accessible, and you don't have to have symptoms to access the testing. We especially encourage people to do that now after the holidays, because as you'll see, roughly 50% of folks who have the virus are still asymptomatic and don't even know they have it. This is our hospitalizations, which are headed in a downward trend in Boulder County. We're currently at 51 right now, and we want to see that decrease. Unfortunately, the way this typically works is we'll see an increase in cases, and then 14 to 16 days after, in general, we'll start to see an increase in hospitalizations associated with those increasing cases. And then finally, what we see, and most dramatically, are our increasing deaths that follow hospitalization. So we want to keep our cases down. We want our hospitalizations to continue to fall. That both promotes support of quality of life in as well as our economic base, and it absolutely prevents people from dying. So keeping our cases down prevents these secondary impacts as well. And again, this is our deaths. The difference between the blue and the orange on the graph, orange is our long-term care facility. So these are deaths in our older age population. And you can see that we had a peak around the end of November to roughly the middle part of December. We are starting to decrease. Again, we're hoping that the New Year's timeframe and the time after that, we don't see a huge jump in cases, because we know that will unfortunately be followed by increased hospitalizations and deaths. So we're hoping that will stay low as we move forward. And one of the things I wanted to highlight here that I think is really important, especially as vaccine is getting out in our community, is the difference that masks can make now. So masks are on the purple line here for both graphs, as you can see. The first graph shows projected daily infections. The second graph shows projected daily deaths. The blue line that's a little bit hard to see in here is rapid rollout of vaccine to our high-risk population. So it's who we're vaccinating right now, which is our priorities in 1A and 1B. And you can see that masks make a bigger difference until the vaccine really gets out in the community at a broader level. masks can make a bigger difference right now, especially when in conjunction with those other things like maintaining social distancing, making sure we're washing our hands. The mask can make a big difference in both of these scenarios. So I don't want to lose the fact that people are thinking that with vaccines getting out there, we can relax. We really need to continue until we have vaccines widely available with wide uptake in our community, which will take some time to get there. That masks are an important component to reducing the spread of this disease. Now I want to focus more specifically on some of the research that we looked at and the conversations that we've had with both of our school districts. And there's been several pieces of research that have been looked at. This is research from the Colorado Health Institute, which was reviewed again at the end of 2020 to look back at what have we seen and what do we know about kids and kids spreading the disease at what ages. In addition to that, there was a statewide task force that the governor put together that looked at how we should be thinking about getting kids back into school, what the risks are associated with that, and some of the strategies. And then finally, the footnote at the bottom of this document, which I know is a bit hard to see, but a document from the Colorado Department of Public Health and Environment that focused on in-person learning in the time of COVID-19 and basically emphasized all the same things that all three of those groups were finding, which is that we definitely see less chance of spread, especially in that K-5 group, where kids are less than 10 years of age. Even though kids in that age group can get the disease, there's much less risk of them spreading it to an adult at that age group. So that is why you saw such strong recommendations from the task force, why there's strong recommendations in the document I just referenced from the Colorado Department of Public Health and Environment, and what the data that we looked at across our metro region confirmed. And that is why we've made the recommendation to both of our districts to have full in-person learning at the K-5 space. We know that that age group especially has had significant difficulty when they're not able to do face-to-face learning. And that age group as well, because of the young age, many people are out of work and not able to provide for their families the way that they need to. So those are the reasons as to why it's really important, especially in this age group, to get kids back in school. And as I mentioned earlier, in general, we see larger transmission or greater risk of transmission as kids get older. That is highlighted over here in this graphic box. That's also highlighted in the document that I'm referencing here, as well as the other documents that we've reviewed. And I'll talk a little bit more about what our recommendations were and why we made those recommendations in just 1 second on the next slide here. But again, this is again a quote from the Colorado Health Institute document that again talks about in-person learning appears to have minimal impact on community transmission. And that is especially true again in that youngest age group. So just want to keep making sure that I'm emphasizing that, because there's often confusion when we're talking about everybody needs to, not socially gather. We need to make sure we're spending time with only our families. But for this age group specifically, there is little risk of spreading of our 10 years old and less age group spreading that vaccine or spreading that disease to adults. And our community actions definitely have impacts on schools. So I want to talk a bit about that. But the first couple of things I wanted to remind folks of is that our school environments are actually providing a stable and controlled environment. And our schools have worked really hard to make sure that they've put all the best practices in place to make sure that they have controls in the school so that there's little chance or as little chance as possible for that disease to spread. If you think about the requirements of masks, making sure that kids have a structured day, all of that provides a lot of stability and control relative to the spread of disease in our schools. The next thing that I think is important for us to recognize, especially as we move forward over these next several weeks, is that our incidence rate, even though it was below the red severe level, for a week or so is back now into the red severe risk level. So we've got to act now to control the spread of this disease, because it has a direct impact on if schools are going to struggle with cases in the school and have to quarantine. It's going to have a direct impact on our businesses, as you know, and as you heard me say before, on potential deaths that could occur in our community. So again, we've recommended full in-person learning at the K-5. We have recommended to both our districts, because we are we are not solidly in orange and our numbers are increasing again in severe risk, to maintain an approach to start with for 6 through 12 as a in-person hybrid. And I just want to reiterate again for folks, because we've had a lot of phone calls and a lot of emails lately, that I make these decisions in conjunction with my chief medical officer and with both the district senior leadership team level folks. So we are in close conversation multiple times a week as we see data changing. If we learn about new research, we certainly link closely and quickly to our districts. And then the last thing I wanted to touch base on here is just the extracurricular activities. And the reason that I wanted to talk about this is there's an organization at the state that provided recommendations on how sports should operate that was reviewed by the Colorado Department of Public Health and Environment. And they also supported those recommendations going forward. And the one that is specifically concerning to not just me and Boulder County, but also to our Metro directors is is wrestling. And I have had tons and tons of emails in the last couple days about wrestling specifically. And wrestling is a challenge for all of us as public health directors, because it is basically a full-blown exposure with kids in each other's faces. And the recommendations from the sports guidance are that wrestling should not have to wear masks because of safety issues, which I can understand fully why that would be a safety issue. But at the same time, if you remove masks, you have kids wrestle, they're breathing hard right in each other's faces. They've got their arms wrapped around each other, even if it's for a short period of time, that can result in a much higher risk for exposure. And as a result, I met with both my chief medical officer as well as Rob and Don, who are the two superintendents. We discussed this with their senior leadership teams, and we agreed that it doesn't make sense to move forward with wrestling in Boulder County. That is being discussed among other districts as well, but that is the reason we made that decision. And I wanted to make sure I addressed it here, just because we've had so much feedback from the community on this. The last thing I'll say here is that the reason that we want to be really focused on sports are extremely important. We know that it gives kids an outlet, but we also want to make sure we're doing everything we can to minimize spread from sports so that we don't have that impacting our ability to keep our kids in school as to the greatest extent possible. So this is the last slide that I have. And again, some of the same messages. The one I want to highlight here is that we still have an estimated 1 in 92 people who are infectious. That's still a lot of infection in our community, comparative to 3 or 4 months ago, where that number was between 1 in 800 or 900 people. So we're not done with this yet. We have to continue to focus. It's preventable. We need to really spend time thinking about not mixing households. The more we can stay with our own families, especially for these next several weeks as we expect to see more cases, the more we can make sure we're wearing masks, washing our hands, maintaining at least 6 feet apart are going to help us continue to keep our cases low. The other thing I'll ask people to do, I've signed up for this. I know that many of my staff have signed up for this, is to go get the exposure app on your phone. It will let you know if you've been in close proximity to somebody who's a known positive, and it will send you information about what to do in the case that you have potentially been exposed to somebody else. And the last thing is that we do have hope with our vaccines are being distributed. It is going to take months for us. The need far exceeds the supply. So we are having to work closely with all of our providers in the community to make sure that we're coordinating getting the vaccine out in a way that gets to our highest risk populations first before we move to our lower risk populations. And we know that will prevent deaths from occurring. So I will stop there, and I want to allow Don and Rob to jump in and add what they are doing and anything they feel like they want to emphasize, because again, this has been a significant partnership between us and the schools, and really appreciate them being with us today.
Thank you, Jeff. Let me turn this over next to Rob Anderson, Superintendent of the Boulder Valley School District. Rob?
Thanks, Mike, and thank you, Jeff. I just want to start with a genuine thank you to Boulder County Public Health for your continued partnership. This has been a trying time for school districts, maybe the most difficult time in my lifetime in trying to lead in schools, and their partnership has been incredibly valuable as we make really tough decisions, right? We know the importance of school and trying to keep kids safe. We're excited to be able to return our elementary school students back to school 4 days a week starting yesterday. Got lots of positive feedback from teachers, parents, kids, had a really successful day. Next week, we'll start with middle school coming back in our hybrid, as Jeff had described, 2 days a week. And the following week, we'll be able to get our high school students back 2 days a week. Previously, last semester, they were going 1 day a week. We've been able to increase that. Feel really good about that decision and moving forward in that way. And just want to thank those of you that have tuned in and are continuing to be engaged on this topic. We know that there's lots of thoughts and opinions on what things need to happen. Just know that here in the Boulder Valley School District, we're committed to continue to work with our health partners and experts as we make really tough decisions, right? And we know that all the decisions that we make, not everybody will agree with. We understand that, but I think what's important for folks to know is that I'm committed to being consistent, and that the health guidance is really driving the ways that we make decisions. So again, thanks everybody, and it's a pleasure to be here today.
Thank you, Rob. And finally, let me turn this over to Don Haddad, Superintendent with St. Vrain Valley School District.
Right. Thanks a lot. I appreciate it. And I too would like to echo my thanks to a lot of people. I want to thank our teachers who have been doing incredible work during this pandemic. They always do incredible work, but truly have outdone themselves. This has been a challenge. Our students and our parents have been incredible. Thank you for the outpouring of support and your resilience and your optimism and your hard work and the sacrifices that you've made. And I too want to thank Boulder County Public Health and everyone for their partnership, because this is a major health pandemic. They have a lot of expertise that they have exposed us to, and we make our decisions in partnership, and we keep the health and well-being of all of our folks, teachers, staff, students in our community at the forefront of all of the decisions that we're making. I had the opportunity today to visit some of our elementary schools. Today was their first day back in person, and the attendance rate was outstanding. We had in the upper 90% in the first two schools I was at. We had 98% of our children there, and all of them were full, and had a chance to talk to a number of teachers. And it really was one of those inspirational moments where you see things coming back a little bit and you feel really good about it. And the kids were great, and a lot of really exciting things happening. Our elementary schools did start today with 4 days a week, and our middle schools will be in a hybrid. Our elementary schools are full in person. Our middle schools will start next week on the 11th in a hybrid model, and our high schools will start on the 19th. We also have other options for our children. If a student wants to be fully asynchronous in an online program, they can certainly do that. And we have about 3,400 of our students who are engaged in our Launched Ed program. We also have the option of fully synchronous with our technology that our community has provided us with. Our students who choose to stay at home can enter into the classroom virtually in real time and participate in real time. So many options for our students. In addition to the hybrid model, which for middle schools will go every other day, and then our high schools are in 2 days a week for each group. We have an A group and a B group, but we're also opening up our schools on Fridays for our grades 6 through 12, where students can come in and they can work with their peers in the library or somewhere else in the school in an environment there on campus. And they can also schedule meetings with their teachers, one-on-one meetings or small group meetings for office hours. And parents can also contact our teachers and staff at any time to achieve any of that additional support. I do want to really emphasize what was said by Jeff around the safety, as safe as we can make them. Our environments, we are requiring masks for all of our children pre-K through 12, and then we are socially distancing to the best of our ability. We have upgraded all of our HVAC systems to very high levels of MERV levels. We also are encouraging hand washing, and we have sanitizing stations. We've revamped our water stations and our drinking fountains so that kids can fill up water bottles. We've increased our custodial staff so that we're doing pretty extensive cleaning in the evenings and during the days. And we are providing testing at no charge for all of our students and our teachers and our staff. And we're also in St. Vrain supporting the community in some of those testing options. As Jeff said, we will continue to monitor the data that we look at, those major areas, the average positivity rate, and then the number of cases per 100,000 students. And we'll also look at hospitalizations. We'll also be paying close attention to the quarantining impact. And Governor Polis has moved us, along with CDPHE, into the targeted quarantining process for grades 4 through 12, and then the general quarantining process for kindergarten through 3rd grade. So the ability to target quarantine should ease some of the challenge in terms of substitute teachers and making sure that our classrooms are filled. But the most impactful thing is going to be what Jeff and all of the folks at Boulder County and other places have been saying, is that we as a community embrace these safety measures so that we can keep our kids in school in a safest way possible. The other thing that you'll be hearing about, and I sent a letter out to all of our teachers and staff, is the vaccination process. We received a letter from Boulder County Public Health, who's working closely with us, and we will be looking at vaccinating the 1B categories where they have it above the line for our nurses and our healthcare providers who work in our system, and then moving below the line with 1B, and they will be supporting and getting vaccinated. That includes educators. And my understanding is that will be sometime in later February, early March. So we're looking forward to that time. The other thing that I would want our community to know in terms of helping to engage our students and continue to move forward in a positive way academically is that we are offering after school academic support several days a week, where teachers stay after and kids can come in during the week after school and get some additional support. We are also going to be extending our school year into the summer on a voluntary basis for our children, and we'll have opportunities K through 12. And again, it will not be mandatory, but it'll be optional for students. And we will have our teachers in smaller class sizes and really focus on those skills and giving them that opportunity for additional instructional time. And then we're also going to be looking at Saturday school options in the next month and a half, where we have some Saturday school, again, voluntary for students, but we'll have teachers in various schools and kids can come in and get some additional help. And the last thing that I would share with you is our counselors and our interventionists stand ready Monday through Friday. Our principals have sent out letters to everyone inviting any student or parent to give us a call if they'd like to schedule an appointment with their student to come see our counselors. Again, Monday through Friday for any help. That might be academic planning. It might be social and emotional assistance and all of those kinds of things. And it's just important to know that we're going to try to do everything in our power to help our students to continue to move forward. And this has definitely been a community effort from the start. We're going on a year of this now here in the not too distant future, but we do see a light at the end of the tunnel with some of the vaccinations. And again, my heartfelt gratitude and thanks to everybody who has participated in this incredible effort to navigate this pandemic. So thank you.
Thank you, Don. We will now go to the Q&A section of our webinar. You will see at the bottom of your screen, it says Q&A. Click on that, type your question in, and I'll read that out for you. We'll get to as many questions as we can. We've got quite a few already. We may not be able to get to all of them. All of our panelists are speaking from a place of respect. We ask that you do so as well. You do have the option to ask a question if you're only on the phone by pressing *9. That will raise your hand and we'll call on you to ask your question. Please, everyone, remain in respect and civil. We'd hate to have to mute anybody. Again, use the Q&A function at the bottom of the screen, or *9 to ask a question on the phone. We have a number of other people that are here to help us answer questions today. Let me tell you who those are. We have Dr. Chris Urbina, who's Boulder County Public Health Medical Officer. We have Chris Campbell, the Emergency Manager for Boulder County Public Health. Emily Payne, who's an epidemiologist with Boulder County Public Health. Trina Ruland, who's with the County Attorney's Office. And Heather Crait, who is our K12 Education Liaison Officer for Boulder County Public Health. So let's get to the questions here. The first thing we have is about older kids in school. It says, what are the metrics that will allow 10 to 17-year-olds back into school? They actually have much more significant mental health risks, such as suicide, substance abuse, depression, etc. What will it take to get them back more than 2.5 days a week? So that's something for our school folks.
I can start that, Rob and Don, if you want me to, and then you could jump in on that. Does that make sense? All right. So what we're looking at, and I put that on that next to last slide, I believe, is that we're not in severe risk and that we don't have an increasing trend in cases. So before this holiday period of time, we were headed in that direction. And the slide that I had that talked about having us out of severe risk previously said, until we get through New Year's Eve and see that we are in a decreasing trend and out of severe risk. We are now starting to see an increasing risk in cases, and we expect to see more. We don't want to bring everyone back into school. And again, based on the data, especially the older kids who we know can transmit a little more readily than the younger kids, until we're getting out of the severe risk and we're on a decreasing trend. We do expect that we will get there, but we know that we're going to have some increasing cases for the next 2 to 3 weeks, probably.
I can speak to that a little bit. And as Jeff said earlier, the things that we're monitoring from a data standpoint, and there are a couple of things. There's the data that we look at. There's the capacity for operations and maintenance and logistics. And so with the data, we are going to continue to look at the positivity rates. We are going to continue to look at the number of cases per 100,000. And if you look at those dials that we've provided, you can see where you fall into the different colors on that dial. And then we'll look at the hospitalizations. We are going to be paying close attention as well to quarantining. And when we start with our middle schools and our high schools, we're going to see what kind of an impact the quarantine protocols have, because when we were going back from October 5th all the way through when we broke before the winter break, we ended up having to do so because the quarantining protocols shifted from general quarantining or from targeted quarantining to general quarantining. And so we actually needed to close our schools at that point to in-person learning, more so because we couldn't operate with staff. We didn't have enough staff. We didn't have enough substitutes, and some of those kinds of things were getting in the way. So it's not just the metrics around COVID, it's also the impact to our staff in a variety of other ways. Now, the one thing that we are going to be looking at as well, because we have an option for synchronous learning, meaning that a child in the grades 6 through 12, or K through 12 actually, but you're asking about the secondary level right now. In grades 6 through 12, depending on how many students choose the fully synchronous model, which is to stay at home and then log in virtually in real time, remotely in real time. For the children who choose that, that opens up some other spaces within the in-person opportunities. And so once we know after those first couple of days how many secondary, middle and high school students have selected the synchronous learning, we will then begin to open up opportunities on a space available for our high school and our middle school students to attend full-time in person, or at least those 4 days a week. And the other thing is again, I want to reiterate that we've opened up our schools now on Friday as well, so that you can be in person, not necessarily with your teacher, but interacting with some of the peers, which addresses some of that social and emotional challenge. So those are the kinds of things that we're doing. It's very hard to put an exact date and time on when we will be able to come back fully in person with some normalcy. We do look at that vaccination target around the end of March, or the beginning of March, the end of February. And so we'll be paying close attention to that with the same objective. As soon as it's appropriate and all parties recommend that, then we'll be looking at coming back fully in person.
Thanks, Don. Thanks, Jeff. I think that, I'd agree with a lot of with what Don was sharing. About both districts, I know we're taking a layered approach. I think that we've made a couple of adjustments since the last time we were in person to hopefully keep us in person and overcome that challenge of staffing when community cases get to a point where that makes makes for staffing challenges in their school district. We've have had over 200 people apply to be classroom monitors. So thanks to everybody in our community who's volunteered to be able to do that. Some of those folks got a chance to get to work actually today in our schools. And so again, thank you for your partnership and support. In addition, we've put air purifiers in each and every one of our classrooms, K-12. We feel like that's another additional layer that can help and support. And we'll continue to work with public health, look at the numbers, watch this dynamic situation. I think that if I've learned anything, and if any of us have learned anything over the past 6 months, is just when you think that you know and fully understand something changes, right? And so I think that it's wise to just be honest and consistent in the process that you use to make decisions, and we'll continue to do that and let the health data drive what it is that we do.
Thank you, Rob. Dr. Urbino, this is probably a question for you. It's about vaccines. Do you recommend that caregivers who work directly with elders in their homes and in long-term care facilities who have received the second dose of vaccine continue to get tested weekly?
Just needed to unmute myself. Can you hear me now?
Yes, we can.
It's a good question. We're learning as we go along with this infection, as many people have talked about before. We're also learning about the vaccines. Because you're not fully vaccinated until you receive both doses of these vaccines, then you still need to be wearing masks, physical distancing, doing all the recommendations that the schools have done a very good job at doing in long-term care facilities. So the answer to your question is, yes, you're not fully protected until you get both doses. Yes, you still should be using all the prevention strategies that we're recommending until we know that the virus is significantly reduced in the community. A lot of the recommendations are going to be a ways out before we can actually totally eliminate many of the restrictions that people feel burdened by at this point.
We have another school question here. Many private high schools are in person full-time 5 days a week, but public high schools are not. This seems incredibly inequitable and is a factor of money. I would think we'd be more in favor of promoting less inequity by getting more people into class.
We have talked, I want to see if Heather wants to answer this. We have had the conversation about the difference between private schools and public schools. Heather, do you want to touch on that?
Sure. So I'm Heather Crait, and I'm serving as the K12 Education Liaison for our COVID response at Boulder County Public Health. One of the major factors in that decision has to do with the size of the institution. So many of our private schools or some of our charter public schools have much smaller student populations. And as Dr. Haddad mentioned, a lot of the decision around staying in person or being in person full-time has to do with the capacity from an operational standpoint. And so since these are such typically smaller classroom sizes, smaller grade, total overall student population, there's an ability to manage the quarantines, the testing, and scheduling that's necessary to stay in person.
Okay, thank you, Heather. We've got a couple of CU questions here. One asks if CU students will be allowed to come back to in-person classes with the rates increasing. Do we have any idea on where that is right now?
Trina, would you like to address what the order talks about in terms of levels and what higher education is able to do at what level?
Yeah, so we have to be in level orange in order for, I'm Trina Ruland, I'm with the Boulder County Attorney's Office. We have to be in level orange in order for the University of Colorado to resume in-person classes. We are there right now per the state's order, but if we were to move back to level red, that would not be permitted anymore. There are some limits on that based on the state's public health order, like the number of students that can be in classes, et cetera.
Okay, thank you, Trina. We have a question about BVSD, Broomfield, et cetera. It says BVSD is a site-by-site district with Broomfield has incredibly low statistics, yet secondary students in Broomfield are being required to stay out of class, being lumped together with Boulder County students. Why doesn't Broomfield Public Health make their own decisions related to Broomfield schools?
Rob, do you want to take that?
Yeah, certainly I can do that. And Jeff, if you want to chime in. And so we've been working with Broomfield Health as well. They've certainly been at the table. You know, it gets really complicated when you think about school districts that serve multiple communities, multiple counties. I would disagree that we're a site-by-site district. Everything that we've done within this pandemic has been at the district level, and we feel like that's the right approach. And when we think about Broomfield, especially Broomfield High, you have a large percentage of kids and families who actually live in Adams 12, right? And so I think that it gets really complicated if you try to parse out certain schools, certain communities so they can do certain things. We want to be consistent. We want to make sure that we're making the right decisions. Again, we've been talking with Jason at Broomfield Health in making all of these decisions as well. But again, this is not something that we've done in a site-based decision-making manner. This is a pandemic. This is a public health emergency, and we feel like that there needs to be strong direction and clarity coming from the district office in dealing with those issues. So I don't know if you want to add anything else, Jeff.
Thanks, Rob. The only other thing I would add is that we plan really closely together, as you've heard me talk about. Certainly, if you've watched any of the BVSD presentations that we've done, we have Broomfield in those presentations with us. If you look at Broomfield's rates are very consistent with our rates. So even though their numbers are lower, the rate of infection in Broomfield is consistent with the rate of infection in Boulder. So, but we do plan very closely together. We make sure that we're making decisions together. We do that because we know how important it is to be looking at how different jurisdictions affect our schools when they're in different jurisdictions.
Thank you, Jeff. We have a couple questions about vaccines I'll put together here. It may be for Dr. Bin, it may be for Jeff. Can you tell us how many vaccine doses have arrived in Boulder County? How many have actually been given out to those who need them? And at what point will different sections, the different groups, teachers, et cetera, have a chance to get the vaccine? I know we're going to start publishing those details on our website tomorrow, but do you have any other information you can share on that?
So
I think
I'm
Chris
going to go ahead
Campbell's
and
on.
turn it over to Chris Campbell if we can.
Hello, everyone. My name is Chris Campbell. I'm emergency manager with Boulder County Public Health. So great to see everyone, and thanks for joining the forum today. We can definitely say we've administered around just over 6,000 vaccines in the Boulder County community. And I'd like to remind everyone we're just now starting our 4th week of this unprecedented mass vaccination campaign. And so we are methodically working through that plan and working to get vaccines out to community members fairly and equitably. I would also say we certainly are following the state guidance. Some of you have seen the shifts in the statewide plan with phasing. And we are following that guidance, working with partners in the community, including the hospitals in the community, Additionally, pharmacy partners in the community and clinics in the community, like Clinic and Salud, to provide access to vaccines for frontline healthcare workers. We're working through that group diligently. We're also working and focusing on the pharmacy partnership, which is working in our long-term care facilities for close staff and residents. That is kicked off, and we know the community members are able to get vaccine through that partnership. Additionally, we are moving into other phases as we move again through groups, working with them. I would like to mention we do have on our website, folks are able to sign up to get a notification and provide their email address and a bit of information so that we can send an email to them and let them know when vaccine is available to them as a community.
Thank you, Chris. I have another question that either Chris or Chris could answer for us. Speaking about testing, which Chris is also involved with, is rapid antigen testing a possibility at Stasio? We do PCR there now. PCR is also done at through BVSD in Lafayette. Can you encourage more surveillance testing of students, et cetera? And can you test septic at schools for virus?
Campbell, do you want to start that one as well?
Why don't you go ahead with that, Urbina? I know you have some thoughts there.
Okay. You know, the PCR test is still the best test we have available for diagnosing the infection. And so that we're always encouraging people to get the PCR test. And that's why we offer that at our testing sites, because people are looking for an answer whether or not they have the infection or not. There are other places in the community that the rapid tests, the antigen tests are available, but we're encouraging folks to use that antigen test in situations where they've either been exposed or have symptoms of the infection. So then the test is more accurate, because the antigen test is not as accurate as the PCR test. So that's part of the issue, is the accuracy of the tests. Diagnosis, PCR, nasal swab. Surveillance, screening, antigen tests, those kinds of things for people that are currently symptomatic. The testing of wastewater is a very good question. There we are using wastewater testing because for people that don't know, on the phone, you actually, if you get infected, you can shed the virus through when you poop or have feces. And so we can actually monitor that wastewater. It's an early warning sign of the infection. And so far we've used it because it's still a fairly new technology. Some of the major universities have used it. CU and CSU have used it to identify locations where they've had increasing surveillance or increasing levels of the virus in the poop. And then they've gone to do testing. So that's not quite readily available, but it's a good idea. And I think in the future, we'll probably be doing some of that targeted testing. But those are all good questions. I hope I answered that one.
Okay, thank you. We have a question here, Mr. Zayak. How often are those slides that you shared updated and published online? Is it weekly? When can we see those, et cetera? Is it daily? It'll be easy to track when secondary students go back full time based on the continuous update to those slides. Transparency is key. I will say that we do post many of those slides on Mondays and Thursdays on the Boulder County web page. We also share those on Twitter and Facebook. You can see them there. And we do often post slides that are presented during these weekly updates on the website for our update. So you can see those there. Anything else you want to add to that, Jeff?
No, I think you covered it.
All right. We have one for St. Vrain. Will St. Vrain Valley School District consider hiring classroom monitors in cases where teachers are at home quarantining so they can continue to teach and students can continue to attend school?
You know, we've hired a number of additional substitutes and special guest teachers that we have in a number of our buildings. So we have done that. They're not necessarily called what you just called them, but the same concept. So we've increased our substitute teacher pool. We also have a number of teachers that are on special assignment, things like instructional leaders, instructional tech leaders and things. And we have shifted their responsibilities to where, if need be, they would move into the classroom to substitute. And so we're feeling pretty good about the staffing situation that we have currently. And in addition, if we get to a place where we need to, we would then deploy our central office staff into the classrooms to substitute as well. So right now we have 3 lines of defense, actually 4, the current teachers that we have in place, the additional substitute teachers that we've hired, the special guest teachers that we have in the buildings, and then also the central office administrators. So that's kind of where we are with that.
Thank you, Don. We have a number of questions about wrestling. Let me kind of clump those together. Basically, is there any situation where wrestling would be reconsidered and kids could start wrestling again? Would masks make a difference? We know that some kids may be going to different districts to wrestle. What options are there for kids who want to wrestle this year?
Jeff, do you want me to take that? Okay.
Yeah.
I'm Dr. Chris Urbina. I'm the medical officer for Boulder and Broomfield as well. So this was a very difficult decision. And I know I've gotten a lot of the same letters and emails that Jeff has gotten because many kids have trained very hard to maintain their wrestling status. Many of them want to become Division I athletes. And I recognize the effort and time they put into this. So this was a very painful decision. I was a wrestler. I was not very good. My younger brother was a championship wrestler. He reached the finals. So I understand the challenges associated with this. But as we go forward, when you think about wrestling, if you understand wrestling, you know that this is a face-to-face sport. And now currently the CHASA recommendations are not to wear a mask. So in my opinion, because this virus is spread respiratorily, that face-to-face contact from athlete to athlete it increases the risk if one of the athletes is infected. So face-to-face, close distancing, inabilities to wash your hands in between or disinfect rapidly after each athlete, and the event occurs indoors, basically increases the risk of infection to not only the athlete, to the other athlete, but the other athletes on the team and the other team that's wrestling those components. So it was a difficult decision and difficult recommendation, but because I'm concerned about the passage of this infection from person to person and to other athletes, I recommended that we do not have wrestling going forward. I realize this is very painful for many of the families and many of the athletes. I hope that they can recover from this. We've all suffered tremendously from this pandemic, and hopefully it'll be over soon as we get vaccinated. But I think this is important that we stop the infection, not only for the athlete to athlete, but the family, siblings, etc. We're very concerned about the high rates, and ultimately, we know, and Jeff included this in one of his slides, is that these extracurricular activities that kids are engaging in can infect them and spread it to other kids. And we want to keep schools safer. And because we cannot make this wrestling a safer sport, and because I compliment both Rob and Don for their efforts to try to make schools safe, I think wrestling, it just doesn't fit into that picture, and hopefully these kids will survive. And I'm counting on all the parents to give them love and support. They will get your support, and there's a lot of counseling available in the schools. I know Rob and Don have made a big attention to this. This is such an important time in their lives, and I hope that people can cope with this decision. But I think going to another district to wrestle is probably not a good idea, because you're going to be exposing yourself to other wrestlers who may not be taking those same precautions. Yes, testing is available. And in fact, many of the college campuses do testing daily on their athletes. The professional sports do that. And you can see all the games that have been canceled because of the spread of the infection. So it's not perfect. It is available. One of the recommendations has come up, and this is still a possibility, that you could delay wrestling for a couple more months. that still be considered, and hopefully the public health directors and CDPHE will consider that. But I think we have to reduce the level of infection before we consider that. And I know I just want to be supportive and try to answer that question as we go forward.
Thank you, Dr. Urbina. Unfortunately, we are out of time. If you had a question that was not answered, you can send it to us at healthinfo@bouldercounty.org. And I believe Chana has a few other things to help wrap up this webinar.
Thank you very much, Mike. Gabby, do you want to put that slide up for us? I just wanted to share that you can get information about vaccination at bouldercountycovid19.org, and the sign up form, if you want us to send you an email when there's vaccine for your group, is on that page in English and Spanish. And we also will share information as we get through the phases on that page. For folks who don't like to use the internet, maybe some family, you can always refer them to the call center. And then we do regular updates, multiple updates daily on our Boulder County Public Health Facebook pages in English and Spanish. So you can certainly refer to those as well. And we thank you again for your time today, and we wish you a good rest of the day. Thank you.